two most important outcomes after ACL reconstruction are basically return to play at pre-injury level on one side and the prevention of the second ACL injury on the other one. So these two outcomes, the important bit is that they have to be balanced. So we should push the patient to return to the same level if this is their desire, but of course we should also minimize the risk of a second knee hit, both to the ipsilateral and the contralateral knee. We can maximize patient opportunity to return to play adopting a systematic functional recovery approach post-surgically. So in our experience, there are 4 factors that we can modify that affects the return to play rate. The first one is quadriceps and hamstring strength recovery. In particular, quadriceps strength recovery is very important to achieve a limb symmetry index greater than 90%, ideally 100%. The second factor is adopting an on-field rehabilitation at the end of the functional recovery before return to the team. In our experience, this will increase by 2-fold the probability to return to play efficiently. The third most important factor is the metabolic recovery. They have to be cardiovascularly ready. And the fourth most important outcome factor is compliance in rehabilitation, the adherence to the program. The second ACL injury is a hot topic, and the warning about second ACL injury is absolutely justified by data, especially on younger cohorts that documented the 20–30% risk at 3–5 years. So we are talking about really frequent re-injuries that we should avoid, especially in the youngest. The optimal treatment by evidence is to lower the risk of second ACL injury is to apply neuromuscular training also in secondary prevention, so during rehabilitation. Our suggestion to do that is to complete the strengthening program, and as soon as the patient is ready to do functional exercises and functional strength exercises, you have to work on movement patterns and systematically adopt the secondary preventative training to decrease the second ACL injury rate. In my opinion, we can really make the difference in clinical practice if we let the patient comprehend that the compliance and adherence to rehabilitation is as important as having good surgery. High quality surgery on one end and high quality rehabilitation on the other hand often leads to a great outcome, okay? But generally patients are not applying a lot of compliance post-operatively. So we need the correct amount of time, the correct amount of sessions and the correct frequency of session to achieve rehabilitation goals. So this is my opinion.